Good morning, everyone. Here we are again, and this time, Ebony and Ivory have finally decided to go for the consult to see how they can improve their confidence and be more, let's say, interesting to their female friends. So here we are with Dr. Bert and Lego Jack, and listening in the background, well, here he is again. He wants to learn, though, the frustrated family doctor. But Ebony and Ivory said, we're here and we want to learn what this is about before we go through with it. So, Dr. Jack explains. Lego Jack explains, and Dr. Bert listens. Well, what we do first is we make sure this is a clean, sterile procedure. Yes, we want to make sure there are no mishaps. Therefore, the provider has to know about penile anatomy. That's common sense. But before we proceed, we have to make sure that the skin, even around the scrotum and the glands of the penis, is thoroughly cleaned with betadine and alcohol. Then Dr. Bert, well, he's going to do what's called a penile nerve block. Sounds frightening, but it really isn't. It's an appropriate way to numb out the organ so you will not feel anything during the entire procedure, and there will be no pain after the procedure. So the penile nerve block is done with 2% lidocaine with no epinephrine to give you adequate anesthesia. Lego Jack continues. Then Dr. Bert will come in with what are called hyaluronic acid fillers, like Restylane Lift, like Restylane Contour, and classic Restylane L. But why are all fillers the same? No. We are going to use fillers that have a high G prime. What does that mean? That means they're there for firmness and thickness, to improve your girth and to give you a bit more length. That will improve your confidence and your involvement with, hopefully, the opposite sex. So, once we do the numbing and the cleaning, then we appropriately put in hyaluronic acid fillers, such as these, to give you the girth and the length that you want. Do you have any questions, frustrated family doctor? No, I'm just listening. I can't believe this will work. Well, the boys have made up their mind, and they decided that they trust both Dr. Bert and his assistant Lego Jack. So we are going to leave them at this point understanding about the procedure and the fact that they are now consenting to go through the procedure and to get what they want. So we leave you with this part of the Ebony and Ivory saga. We'll say goodbye to the frustrated doctor. We'll say, see you later, Dr. Bert and Lego Jack. And boys, we'll see you later when the procedure is done.